intensive care teams do, not what they say. My name is Patrick Hutzel with another quick tip for families in intensive care. So one thing that when you have a loved one critically ill in intensive care is what you must make a distinction between what intensive care teams do versus what they say, right? Actions speak louder than words. And, when I talk to clients, they tell me, oh, the intensive care team says this and says that. Yeah, but what are they actually doing in practicality? So case in point, we're currently working with a client who has their 80-year-old dad in ICU after cardiac arrest and some form of hypoxic brain injury, and he's not quite waking up yet. He's ventilated, he's got a tracheostomy, he's got a nasogastric tube, but the intensive care team is not doing what they're supposed to be doing, which is, getting him mobilized. He's ready now to be mobilized. He's ready to have physical therapy. He's ready to do all the things that a critically ill patient needs to do when they are more stable to get on the path of recovery. So, and, we've helped the family to make adjustments and make complaints to the intensive care team and to hospital executive to make sure that their loved one gets best care and treatment. I mean, that's what we do here at intensivecarehotline.com, and we're always getting results for our clients. And you can verify that on our testimonial section, and you can verify that on our intensivecarehotline.com podcast, where we've done some client interviews. But coming back to our example, even the hospital chief medical officer now had meetings with family, and they're saying, the chief medical officer is saying all the right things. Yeah, we'll be doing physical therapy, we'll be doing mobilization, we'll be optimizing nutrition, and yet nothing actually happens, right? So it is really, really important that you actually know your rights. Many families don't even know that they have rights, and pulling the right levers, which means making complaints and escalating the care that your loved one needs to get. Most families in intensive care, as a matter of fact, 99% of families in intensive care don't know what they don't know. They don't know what to look for. They don't know what questions to ask. They don't know their rights, and they don't know how to manage doctors and nurses in intensive care. And many families, when they come to us, they realize that there's a whole world beyond what the intensive care team is telling them. Once we set them up with the right questions to ask, once we set them up or explain to them what they need to look for, they realize, that many intensive care teams, not all, are not doing the right things. And you need to find that out as quickly as possible. But the purpose of this video is that you need to look for what they're doing and not what they're saying. And you need to look for that improvement for your critically loved one. And just because the intensive care team thinks it's a quote unquote hopeless case, and they, if you the doom and gloom talk, but they are negative, you have to ignore that, and you have to look for, okay, what can be done to improve your loved one situation? What is it that you can control? Not what is it that you can't control? What is it that the intensive care team can control? For example, what they can control is making sure, in this situation, someone that's hemodynamically stable, that has no fractures, getting them out of bed, getting them mobilized, giving them excellent nursing care, that in and of itself helps very often. So I hope that helps you understand that you need to watch for what intensive care teams are doing, not what they're saying. I have worked in critical care nursing for 25 years in 3 different countries, where I worked as a nurse manager for over 5 years. And I've been consulting and advocating for families in intensive care all over the world since 2013 here at intensivecarehotline.com. And I can very confidently say that we have saved many lives for our clients in intensive care. And you can verify that if you go to our testimonial section at intensivecarehotline.com, or if you go to our intensivecarehotline.com podcast section, where we've done client interviews, and you can verify that we have saved many lives for our clients in intensive care with our consulting and advocacy. And we have helped hundreds of members and clients over the years with intensivecarehotline.com. And that's why I do one-on-one consulting of the phone, Zoom, Skype, WhatsApp, whichever medium works best for you. I also do it in person I can come to you if you want to. And that will help you to make informed decisions, have peace of mind, control, power, influence, making sure your loved one gets best care and treatment always. And when I talk to you and your families directly, I handhold you through this once-in-a-lifetime situation that you simply can't afford to get wrong. I also talk to doctors and nurses directly, and I ask all the questions that you haven't even considered asking, or I can set you up with the right questions to ask. I also represent you in family meetings with intensive care teams. We also do medical record reviews in real time so that you can get a second opinion in real time. We also do medical record reviews after intensive care if you have unanswered questions, if you need closure, or if you are suspecting medical negligence. We also created a membership for families of critically ill patients in intensive care, and you can become a member if you go to intensivecarehotline.com. You click on the membership link, or if you go to intensivecaresupport.org directly. In the membership, you have access to me and my team 24 hours a day in the membership area and via email, and we answer all questions intensive care related. In the membership, you also have exclusive access to 21 ebooks and 21 videos that I've personally written and recorded that are only accessible to our members. And all of that you get, again, at intensivecarehotline.com. Call us on one of the numbers on the top of our website, or simply send us an email to support@intensivecarehotline.com with your questions. And if you like my videos, subscribe to my YouTube channel for regular updates for families in intensive care. Click the like button, click the notification bell, comment below what you want to see next, what questions and insights you have from this video. Share the video with your friends and families. I also do a weekly YouTube live where I answer your questions live on a show, and you will get notification for the YouTube live if you are a subscriber to my YouTube channel, or if you are a subscriber to my intensivecarehotline.com email newsletter at intensivecarehotline.com. Thank you so much for watching. This is Patrick Hutzel from intensivecarehotline.com, and I will talk to you in a few days. Take care for now.